All right. Good evening, everyone. I am Lori Ledley, the clinical sleep educator for Valley Sleep Center. I'm also the founder, and we have Armida Carr here from New Horizons Therapy right here in Ahwatukee, Arizona. And Armida is a speech pathologist, correct me if I'm wrong, and an occupational therapist. And tonight we are talking about ADHD, autism, and sleep. And I know there's a ton of parents out there that really struggle with these things. ADHD a lot of times can be misdiagnosed. There could be an underlying sleep disorder. A lot of these kids have autism nowadays, and their sleep is so challenging. So I was so excited when Jackie offered you up, Armida, and it's just wonderful to meet you. And I really look forward to listening and getting some feedback. If you're out there on Facebook and you have questions, or you want to reach out to me personally, feel free to chat in the comments. If you're on the webinar, thank you for joining. And I think Armida has a surprise to tell us when it's over, so stay till it's over. And feel free to chat anything in the chat or ask your questions in the Q&A. Welcome, Armida. Thank you again for doing this.
Yes, well, thank you, Lori. That was very sweet. And yes, I'm a speech language pathologist, and our team does consist of occupational therapists. So it's few of us at the practice. So I will go through, I kind of put a slideshow together, and yes, any questions that come up, feel free to ask, butt in, I'm okay. I know it's a lot of information, but the bottom line is, just kind of helping how we get these kids to bed and we're not going crazy. I will share my slideshow and we'll go from there. So
all right, I'll just be here on standby if you need me. Okay, thank you.
So I won't be able to see the questions, but I'm sure Lori will kind of get to me. So here's my cover to start with. So so ADHD, ADD, autism, and sleep, and we're going to kind of combine it together and see, how we can help parents, both trying to fix an environment that is comfortable and also kind of routines and mattresses, comforters, beds, whatever, might be helpful. So with that, I will go to our first slide. So here's part of my team. We do have an amazing group of people that work at New Horizon Therapy. We are there. We started in 2017 in a small space and quickly grew to a larger space. And now we have new staff, a new equipment, new area where we can definitely accommodate new clients as they're coming in. So here's part of our team, and our team has grown since this picture was taken. So once again, I am Armida Carr, and I am also a bilingual therapist. So I do see a lot of Spanish speaking children or other languages. So just because I'm bilingual doesn't mean specifically Spanish, but there's other stuff. So I have my motto, let's make the world more expressive and articulate place to shine, one person at a time. Because I do see all of the kids and adults that come into our practice, we are all individuals and we all shine in a different way. So that's why I say one person at a time, because we can all make it happen if we all try. So sleep, how does it, what's the typical pattern and what's the typical hours of sleep for children? Some parents, I think it's always so important, first of all, to start with that. So as you can see, ages 1 through 3 require a lot more sleep. As we go on to ages that are a little bit older, the hours start declining. And then as adults, I think, they say 8 to 9 hours of good sleep. So it also affects adults as well. So, and then also when you're looking at these times, kind of consider whether your child naps or not, because that can also impact the way they sleep or the amount of hours they sleep. Autism, and sleeplessness. I know a lot of parents that come to our practice, that is one of the things they do mention they struggle with, even kids with other diagnoses that are unsettling, the ADHD and other things that kids might be struggling with. So 40 to 80% struggle with sleep. The challenges, difficulty falling asleep, inconsistent sleep routines, restlessness or poor sleep quality, and waking early or frequently. And I do, again, have parents that come in and I'm so sorry they woke up at 3. I'm so sorry, they woke up at, wee hours at the night. So we get these kids in our sessions that are sometimes a little crabby. So we try to help the parents kind of develop a routine and a schedule for these kids. So what is the cause of, especially with kids with autism? Nobody really knows what causes them not to be able to fall asleep. Some of the things that I found in our research is, they miss social cues. So as the family is resting or getting ready to lay down and fall asleep, they might be playing, but they miss listening. Oh, it's kind of that time to quiet down or to settle down and kind of prepare for that bedtime. Melatonin levels can be off, so either too high, too low. The other one is increased sensitivity to outside stimuli, such as touch or sound, anxiety. And this can be, again, so many of our kiddos require, it's either too much light, not enough light, the blankets aren't perfect, they're too hard, they're too soft, or other kids struggle with, just knowing that routine and not understanding what, what happens, when I go to sleep, how am I going to get up in the morning? What's going to happen in the morning? Am I going to miss school? So these are all things that kids, especially with autism, struggle with, because they are so, I need to know what's going to happen. And that's, just kind of a daily thing that occurs. So ADHD, kind of similar, kind of goes along the same lines. They have a really difficult time keeping a schedule. So sometimes these kids will want to do everything at once, or they could be doing one thing and suddenly want to jump to the next thing. Or they could be, kind of close to that bedtime and suddenly realize, oh my gosh, I forgot to do this. Or, the mind sometimes just keeps going in these kids. Sometimes medications that are used to treat the ADHD can make them feel awake and kind of finding that time to quiet themselves. It does make it harder. Sometimes kids consume too much sugar, caffeine, or, they start getting really hyper at night. And again, kind of for us, we work also with other professionals and kind of building a routine for kids. It's not just about speech and occupational therapy, but we also involve the doctors or other professionals in the field that can help us with these kids that have these challenges. So some bedtime routines definitely help. And again, every single child, adult, we're all different. We all require something different. When we have the kids, we definitely work with parents to figure out a system, a schedule, what works, what doesn't work. Because like we, that one light to shine, every single one, that little light might be a little different. So we do work with the parents on this and try to get them to get some rest and get, for them, to get their children in bed too at a decent time. So some of the things that have helped, designing a calm sleeping environment, which could be special lighting, white noise sound in the background, a bear, a toy, and sometimes we have to change it up. And again, at first, I think it's just trial and error and to see what works. For me, I need at least an hour for me to kind of start calming down. And, what is it that I need? What is it? Do I need my bed? Do I need that light? Do I need a sound? So I know over the years, all of us have developed a routine that works for us. So our goal is to find that same routine for children, despite the challenges they may be having. So the other thing I wanted to touch on is tongue-tied, because in children and some adults as well, because that also impacts the way we sleep. I have seen many at our clinic, children and adults, and what is it? So sometimes when our tongue is tied, it just means the bottom of our tongue has a little string and it's just shorter than it should be. This impacts the way we speak. It impacts, I think I have a slideshow, but yeah, that also affects our sleep, because then, it kind of changes the structure. So, okay, that's adults, but I thought I had it in here. So yeah, so I guess this one is tongue tie in adults, and what does it look like? So a lot of times when I get adults, if you are an adult and have had speech services, all your life, and you're still saying, man, I still can't say this sound or that sound, especially the R, the L, the T, the D, when your tongue is lifting. The other big red flag too is, if you're eating and you find yourself consistently clearing your mouth with your hand, your finger, or you can't clear it with using your tongue. A lot of times people will also say, it just affects the way I sound, because sometimes people will have all their sounds, but they almost sound a little slushy. The other thing is, if we have that tongue tie, the roof of our mouth starts going higher and higher. So we start developing this almost like a V-shaped palate. The roof of our mouth becomes like this because our tongue naturally sits on our palate. So when our tongue is not there, the roof of our mouth starts going up. And then when it goes up, it presses back and it starts going into the, where our breathing occurs. So it kind of starts making that smaller. So now we're opening our mouth a lot more in order to breathe at night, especially with, we could start snoring. So sometimes it's like we're people with sleep apnea where they start gasping for air. They start just like trying to get that air in, because again, that airway has been constricted and it's kind of in the back. So it kind of starts affecting, the whole mouth. Sometimes what happens, the teeth, instead of sitting nice and curved, they're supposed to be like a dome. They call it the Rome dome. If that doesn't happen, if our tongue is tied and here our palate is going up and our teeth, suddenly start kind of caving in as well, because as our palate goes up, it's pulling our teeth together. So that's, so, something that definitely to consider, to look at if it's any of those little red flags sound familiar. And again, we're always available to answer questions because it can look so different on everyone. Let's see. So here is where we're at. We are in Phoenix and Ahwatukee, but we are still seeing people virtually. So we do actually have some people that are out of state that were with us to begin with, and then have moved out of state, but have continued with us, and we do their services virtual. So we're always available for that. So with that, I know that was a lot of information. I will be more than happy to take questions.
All right. Thank you. That was awesome. So let's open it up for questions. I have a question for you because in my training in sleep, we were always taught that if a child is representing with ADHD or ADD symptoms, or the teacher's complaining about them not paying attention, because back when schools were, and kids were going to school all day, every day, Monday through Friday, teachers would notice things that maybe the parent didn't notice, right? Is that what you experienced? So my question is, have you seen in your practice kids with ADHD actually have sleep apnea?
Yes, I have. Yes, we have. There have been, kids that come in, and a lot of them, we just see sometimes that open mouth posture. They get in the habit of opening their mouth and not being able to breathe the right way. So they're constantly doing this. So when they close their mouth, now you have this.
Well, recognizing that mouth breathing is, kids should breathe through their nose. That's,
yes.
If they're breathing through their mouth, we definitely would love to see them and evaluate them, right? Both of us.
Yes, absolutely.
So you mentioned in your slides, get a sleep test. So Valley Sleep Center, that's what we do. We do sleep studies. We have 7 locations. I have a few board certified pediatric physicians who also are board certified in sleep medicine. So that those are really good to know. And you don't need a referral. You can come directly to us, and we're contracted with most insurances. So here's our first question. How consistently should a patient get therapy for speech?
It really depends. Each kiddo or each adult, it's kind of like looking at someone and trying to figure out what they need. Also, it's dependent on the parent as well. Sometimes parents can make it once a week. Sometimes parents can make it twice a week, but it's all dependent on the child, what the assessment tells us, and the referrals, and then kind of, the deficit, if it's really low or not as low. And, so it's really dependent on the child.
All right, here's an adult question. How do adults who are overcoming a stroke regain their speech?
So that one, yes. So, I always say when a patient has a stroke, sometimes people have the wait and see what happens. And I always say that when a stroke occurs, it's almost like a bruise. And in that moment, you want to start receiving speech services to regain that connection in the brain. And the longer you wait, the longer that, the less progress that will occur. So you do want to come in as soon as you can to regain as much speech or as much language as you had prior to the stroke.
Right. I want to point out too, since we're talking about stroke, that, if you or your partner snores or gasps when they're breathing, these are high risk for stroke. So get that obstructive sleep apnea treated prior to you having a stroke. Really, really important and key.
Yeah. And I will say, even with the sleep apnea and the stroke, a lot of people are tired. That's the sleep apnea thing that I've noticed, just really tired, or, that thinking ability just kind of declines because they're not sleeping well.
Don't ignore those signs. It's a simple thing. You can get a virtual consult, just like we're talking right now, a home sleep test mailed to you that you throw away that hooks up to your Apple, not your Apple, but your smartphone with an app, and then a virtual follow-up. You don't even have to leave your house now to get diagnosed and treated for sleep apnea. So, and there's lots and lots of options out there for treatment. CPAP's not the only one. There's oral appliances. We have a new upper airway stimulator called Inspire Sleep Therapy. And I actually just got a Facebook message right now that I was responding to. Sleep apnea in children is a tonsillectomy the only option. And it's really not, but that's kind of where we start. But, talking to someone and even seeing someone like Armida to see, like, is that tongue tied? Is there something, through therapy that we can do to strengthen, the airway and the soft palate? You can do palate expansion through orthodontia. There's just, it's not always surgery, because I know not everybody is going to be a surgical candidate, but the American Academy of Sleep Medicine and Pediatrics would recommend a tonsillectomy if your child is struggling with sleep apnea.
Yeah.
Yes, we do. Someone asked if we do sleep evaluations for children. We do. We have several sleep specialists, both physicians and nurse practitioners who specialize in sleep for children. How about you, Armida? Do you ask the sleep questions when you see somebody?
When somebody is coming for, again, when we have those tonsils or when they're not sleeping, and yes, I do ask some of those questions because that's part of my assessment. Are they sleeping? Are they not? And again, it's, when we have the diagnosis, we talk about, because that's also something, well, let's try this before we do surgery or before I recommend that. So sleep is something I definitely ask about.
That's awesome. Well, I would love to hear your surprise. And I want to say thank you to Dr. Melody Rodarte and Activated Health, because I'm live from her office tonight because I was super close and needed internet. So those of you who don't recognize my background, I'm here. Beautiful office. So thank you, Activated.health. So great place to come if you guys need internal medicine medicine. If you need a medical doctor, she's amazing. She's the reason I'm on the earth. All right, I want to hear your surprise.
So our surprise is about a month ago, the Arizona Coyotes selected 5 small businesses to promote at the Coyotes game next Friday, and to give, and also with Share Care, which is also another provider that kind of promotes healthy living. And they're giving us a grant to kind of for our staff to use that to kind of promote our health. And Blue Cross Blue Shield is part of the group as well. So we'll be at the Coyotes game next Friday with our team, kind of receiving all this love and care from the Coyotes. So
congratulations. Yeah. That is so awesome. Make sure you guys post pics. I want to see.
Yeah, we definitely will.
All right. Any last questions? And I can let you go. Thank you again so much, everyone, for being here. Thank you, Jackie, for helping introduce me to Armida. I look forward to seeing you in person somewhere. Maybe the Coyotes game.
Right.
I wish I was going to be here. I love hockey. That sounds so fun. All right. Well, thank you, everyone. Have a great night.
Thank you so much.
Bye.
Bye-bye.